What causes lymphoma misdiagnosis concerns? Imagine trying to solve a complex puzzle where many pieces look alike. That's similar to diagnosing lymphoma, a type of blood cancer that affects the lymphatic system. Lymphoma includes many subtypes, especially within non-Hodgkin lymphoma, each with unique features. Because these subtypes can look very similar under the microscope, doctors sometimes confuse one for another. This is a major reason for misdiagnosis. Studies show that errors in identifying the exact subtype happen quite often, sometimes nearly a quarter of cases. Accurate diagnosis requires highly specialized tests and expert knowledge, which not all medical centers may have. Symptoms of lymphoma can also be tricky. Swollen lymph nodes, fatigue, fever, and weight loss are common signs. But these symptoms are not unique to lymphoma. They can mimic infections like influenza, mononucleosis, or even HIV. Because of this overlap, doctors might initially think it's something less serious, delaying the correct diagnosis. This can happen especially if they do not immediately perform the necessary tests like biopsies or detailed blood work. Getting an accurate diagnosis depends heavily on lab tests. Pathologists examine tissue samples using techniques like immunohistochemistry and molecular studies. However, errors can occur if the testing isn't thorough. For example, if certain markers such as CD5 or cyclin D1 are not tested, a type of lymphoma called mantle cell lymphoma might be mistaken for another disease. The quality of testing varies between hospitals, and incomplete testing can lead to incorrect classification. Another challenge is the expertise of the person reading the tests. Diagnosing lymphoma requires specialized knowledge in hematopathology. General pathologists might find it difficult to distinguish lymphoma from benign or reactive lymphoid conditions. Research shows that when second opinions are sought from specialists, up to 40 to 45% of initial diagnoses are revised. This highlights the importance of consulting experts to reduce errors. Delays in diagnosis also play a role. Sometimes, symptoms are not recognized early or biopsies are not performed promptly. Waiting too long can allow the disease to progress, making treatment more complicated. Misinterpretation of test results or overlooking suspicious signs can further contribute to misdiagnosis. Lymphoma classification has evolved over time. While the World Health Organization system has helped standardize diagnoses, applying these criteria can still be challenging, especially in community hospitals without access to specialized resources. This ongoing complexity adds to the risk of misdiagnosis. In summary, concerns about misdiagnosing lymphoma stem from its biological complexity, overlapping symptoms with other illnesses, limitations in testing, and variability in medical expertise. To improve accuracy, doctors need to conduct comprehensive evaluations, use detailed testing methods, and consult with specialists. Accurate diagnosis is essential for choosing the right treatment and giving patients the best chance for a positive outcome. If you or someone you know is facing symptoms that might be lymphoma, it's always best to seek care from healthcare professionals who can provide personalized and thorough assessments.